throughout the pandemic, starting from day one, even before we had our first case in Michigan, we knew that this virus was hitting our nursing homes especially hard. And yet, here we are more than a year and a half into this pandemic, and I feel like we still don't have the straight answers as to the true impact it's had on our elderly people. And the one person who's been trying to get to the bottom of this, Charlie LeDuff, he's a very well-known journalist here in the Metro Detroit area and also the host of the No BS News Hour. Please download his podcast and subscribe. But with that, Charlie, I always want to say thank you for taking time to be with us.
Thanks for having me on. Appreciate it.
Charlie and I used to work together at Fox 2, and your desk was not directly across from mine. Look at that, Heel Perkins, but kind of catty-corner. And I will tell people, one of the first things you said to me, we were talking about Pontiac. And as everyone knows, I live in Kegel Harbor. I volunteered for years in Pontiac. It's very close to my heart. And at that time, Pontiac was just starting to go through the emergency manager situation. And we were talking, and you looked at me and you go, "You're not the dumb blonde I thought you were." Because I was per diem back then, by the way. So I was like, no, because Pontiac really was, in my opinion, kind of, the experiment that everyone should have been watching and paying attention to before we got to the bankruptcy in the city of Detroit. But no one was really watching or listening.
No, I apologize. I didn't mean that you were not really a dumb blonde. I just realized that you dyed your hair and that you're not a blonde.
I know. I do have a twin sister. She has brown hair, brown eyes. But with that, though, Charlie, I will say, though, but it's right. Sometimes these things come up. But, one thing that I think everyone respects about you, some people love you, some people hate you, but no one can dispute your love and your passion for the city of Detroit, because you could be working anywhere right now, but yet you've chosen to stay home. And hopefully people can see between their opinions and the politics and appreciate the work that you've done, because I will say, I don't think we would be anywhere near this conversation on the deaths in our nursing homes had you not only took up the fight, but continued the fight as well.
Yeah, well, it's important. We shut down all human endeavor to protect not only the elderly, but the infirm, the weaker, the handicapped. It's more than just the elderly. These are institutionalized citizens that, I'm taught to respect the older people. And we didn't do a very good job. We didn't focus. We shut down the economy. We shut down the schools. It had a very deep effect. And what did we get? And it's not a sort of after the fact. This is, as you said, it's been going on for 15 months. And I just have to say, where was everybody? There's a vomit of statistics every day, transmission rate, mutation rate, we're looking at death certificates. We're doing the whole nine, but we never really focused where we needed to. And now it's coming out. It's quite obvious that we never did keep a proper count of nursing homes. And when I say nursing homes, I guess we'll get into it, but we did force the Director of Health and Human Services to come out and give testimony to the House Oversight Committee. And they did a nice game of dancing around and confusing you at home. Because when we say nursing homes, we the people just mean sort of like old folks homes, right? But nursing home is very specific. It means 24-hour nursing care. They draw on Medicaid and Medicare. Then you have homes for the aged, which are like nursing homes, but they don't draw on Medicare. It's more like Medicaid, and they don't have 24-hour nursing. And then there are the adult foster homes. Those are those group settings in your neighborhood where 5 elderly people will live there. We're supposed to have been counting all of those. And in that whole entire group, it's come to light that about 25% of them weren't even required to report at all, much less the rest of the numbers you're getting, which we can get into. So the fact is, I believe the House Oversight Committee is going to ask the Auditor General of the state to start looking through each and every of the 19,000 deaths to find out where people lived before they died, not just where they died. That's what Cuomo was doing in New York. You know, whether you lived in a nursing home and died there or died in a hospital, you're still supposed to be counted as a nursing home death. And all that group put together for our purposes here today will be called nursing home. But what they really are long-term care facilities.
And I'm glad that you are trying to inform people of the differences as well, because we know that impacts the numbers that they're trying to share as well. I will say my mom, we were lucky, I don't want to say lucky enough, but she was in Ohio when she fell and then she had a stroke and then, but we were able to visit her. Whereas in Michigan, we wouldn't be able to, but then she got transferred to a long-term care facility, a rehab center, and that's where she passed away. But it was hard because once you were in there, you couldn't visit them, but you could visit them in the hospital. And so when you die alone, it leaves this impression on your hearts as the children of some of the people and the victims. And you're here in the state of Michigan. I feel like in Ohio, they've at least addressed the issue. But in Michigan, there are so many families that are left in limbo because their loved ones died alone.
Yeah, and they deserve answers, you know?
Absolutely. And with this, Charlie, if I can even, we've been reporters long enough to know that anytime you needed an investigative story, all you had to do, nursing homes. We would be bombarded with people with complaints from some of these facilities. And this is at the time they're supposed to be state regulated. But yet the government goes in and they say, we're going to allow you to self-report. This is an industry that hasn't had a good record of self-reporting anything.
Let's do that. I mean, first of all, the numbers you're getting are self-reported numbers. That's it. Remember, Michigan was one of the very last states. Y'all remember, like a whole year ago, we were one of the last states to even report deaths. It was never required to this day by the governor's pen. She never required it, nor did she require, by her own pen, testing for the residents. That came later with the Director of Health and Human Services. So naturally, there is some incentive for these facilities not to report accurately. And who's going to go back from the beginning of the pandemic to start to measure where the real death was? Well, guess what? Last summer, the state did. They hired a firm. Once the federal government said, y'all have to start counting these, we hired a firm. They went back. Out of 8,000 deaths, they randomly took 1,500 death certificates, right? I'll show you. And they found out that 650 of these things were from nursing homes. I don't know if it's long-term care facilities or just nursing homes. That's 44% random search of the deaths. Not only did the state not add those into their numbers because they're afraid of a double count, they stopped counting. They stopped counting. So now we're claiming somewhere in the area of 29% of our deaths are in these rotten, fetid cattle pens. Just like you said, the state stopped inspecting them during the COVID spike because the inspectors were too afraid to go in. So they were just making phone calls. So we really have no idea who died. I was just going to show you a death certificate. There'll be a place on the death certificate that tells where you died, like the hospital. Right. Then it'll give you a place of residence. They never bothered checking the place of residence. Now, there's a guy, an 86-year-old veteran. His name's Clarence. This whole thing's kind of in his memory. That's what I'm motivated through. It took 8 seconds to put in his address, and you found out it was a Detroit nursing home. But it's doubtful that he's counted as a nursing home death. So we need to know what's going on in those places, what level of care. So whatever just happened, we can fix in the future. And let's be honest, let's be really honest. We're now in an election cycle, and we need this answered so we can make a legitimate conclusion about the level of leadership that we got through this pandemic. Because as you guys were talking about earlier, remember the Wuhan lab thing was a conspiracy theory and a hoax. Yeah. The stolen election, like, can we just get honest and nonpartisan about what our leadership's doing, what these political parties are doing, and how everything's being warped. And yet all of us aren't really getting much. That's why we need this thing to come to a conclusion and figure out what was really going on in those long-term care facilities. And I'm not going to stop till we get it.
And you know what's so sad is this has become so politicized. At the
Yeah.
end of the day, for our politicians, shame on you. Both sides. Like, this is not a political issue. This is a life or death issue. We're all real people. And the people who died, some of them are Republicans, some are Democrats, and some are independents. At the end of the day, they're
Yeah.
all Americans. And you need to own your mistakes. But you had to sue, and you did it with the Mackinac Center for Public Policy. What was that
I had to sue the
process
state.
like? That's
I had to
ridiculous,
sue
too, by the way.
for data.
But even then, the data that you're getting, is it even accurate?
No, and again, like, yeah, shame on our politicians, but shame on our bureaucracy, and shame on our
Yes.
political parties, because it's all, and shame on the warped contractors, and shame on the executives and the owners of these facilities. You all go around taking the public's money, taking your check every week, and you're tight-lipped. I've had directors of nursing in these nursing homes blow the whistle to me. They've been on my podcast, but I haven't had anybody in the bureaucracy say, "Hey, dude, we were piping the numbers." They haven't done it. Why? Because you get along to take your check.
Yep.
We cut your check.
Yep.
We just want this to work. Why would I have to get a think tank? I got to find some guys in suits so people take this seriously. Like, it's not LeDuff out there going crazy. I have a nonpartisan, very august, very serious think tank, the Mackinac Policy Center. And we're trying to get data that's incomplete, that they're trying to obfuscate, that they're trying to misdirect. And it's real simple. This is what we do. There are 19,000 deaths. There's a name and there's an address. Run them in. Give me the 19,000 death certificates. Give me a college class.
Hey,
and we'll
I
get
have a
this thing
niece
done in
that
a
just graduated from the University of Michigan in public policy. I'll donate her time.
week. It's easy to donate
Sorry,
somebody
Emma.
else's time. But it wouldn't be that hard. Would it be 100% accurate? No. Would it be better than what we have now? Yes.
Yeah.
So I'm just going to say it. When Director Elizabeth Hertel of Health and Human Services does the misdirect and says the nursing home data is accurate, like lemmings, the media gobbles it up because they don't know what she's talking about, and they let themselves be used. Of course, the self-reported numbers are accurate because the state is simply reporting what the nursing homes had just recently told them. That doesn't mean it's scientific. It doesn't mean statistically it's correct. So we got to get off our butts and especially in the press, and do better by the public. That's why they hate us.
I'm going with you on that one. I will say, as someone who left mainstream media and has no desire to ever go back, you're talking truth. And I spent years defending the media to law enforcement when I worked for ATF. And you sit back now and you view things with a different viewpoint, and you're like, they didn't deserve that defense. Get off your butts and do your job. Your job is not to be friends with your elected leaders or with anyone. And you can be a friend, but you still have to report the news. And the numbers are the numbers, the facts are the facts, and do a little bit of reporting. So, Charlie, with this as well, do you feel like kind of a lone wolf out there on your own?
I don't think of it that way. Yeah, okay, yeah. Like, once the House Oversight Committee had testimony from my lawyer, Steve DeLee from the Mackinac Center, and then Director Hertel, and I saw these headlines coming out, and within the stories, my name's buried. I'm like, okay, she disputes what reporter Charlie LeDuff says, and I'm like, well, where were you last week when I came out with the findings? Only Bridge Magazine even double checked it, and they found out our findings were correct. But nobody had the guts or the balls to look for themselves. They're waiting for the state apparatus to dump on us, and then they're going to dump on it as well. But you know what, guys? We're right. And you're also mad because you weren't on the governor and her airplane, and you took the silly excuses about, having to see the dad, and it was 2 days or less, and it was really 4 days, and you paid, but you didn't pay, but your slush fund paid, but they didn't pay. Your daughters are down there. Every step of this way, what I was doing for the public is, I didn't believe Snyder and Flint. I don't believe Whitmer in the nursing homes. I don't believe Doug in downtown in these demolitions. I didn't believe Trump and this election fix. I'm just glad the founding fathers wrote it in that I can't be sent to prison for telling the truth, because that was pretty savvy a couple hundred years ago, because that's what they do to you.
Yeah.
We're just being lied to. And enough. I mean, the economy is screwed up. The kids' minds are screwed up. Did we do the best we could do it during this pandemic to protect all of us and our future? Because we made decisions that are going to have ramifications decades from now. And I just think we got lied to.
I had a medical professional in the early stages of this say we were doing it wrong. He was like, the people that are at risk need to be the ones staying at home. The rest of us need to be out. And then what we found here in the state of Michigan is, because of our lockdowns, they put it in a nice way, though. Due to our lockdowns, and we were so restrictive, we had the third surge where so many other places didn't. So that's why Florida...
That was a lie. Nobody looked at it. Remember, the governor said we were so effective that we don't have antibodies, right?
Yeah.
Well, it turns out the CDC does antibody checks. What they do is they go to commercial laboratories, and they take random samples of blood, not just COVID patients, but let's say you got to have your appendix out, or a random physical. Turns out that we had the same level of antibodies per capita as Florida. That wasn't locked down. It turns out that California, that was locked down, had a higher level of antibodies. New York we were somewhere in the middle. So it was complete and utter nonsense that got re-reported without being vetted to explain the third surge. Maybe this is why we had a third surge. Our public health stinks. Our nursing homes stink. Our hospital system stinks. Our water systems stink. Maybe this place is falling apart, and we all got to get together with the press's help to figure out how, why, and where, and fix it. That's what I suspect was going on.
I think one of the biggest things to come out of this COVID, we're talking about so much money right now due to, I hate to think about this, and I always like to ask the Democrats who are so on board with spending this money. I was like, oh, you care about our kids, right? Yeah. What about the kids 20 generations from now that are going to be paying for this, and you're wasting money? Let's actually use the money where it needs to be. And one of the things that needs to be fixed is the healthcare system and how we report things, and these computer systems need to be able to speak to one another. Following 9/11, we switched how our first responders communicated to one another. Let's do it with this. It's not rocket science, people.
It's funny you said that, because during the testimony, I guess the media was off at the toilet when she was saying this. Director Hertel said, we can't, they have the death certificates, right? It's codified in the counties. And the Department of Health and Human Services also has another computer system, where the nursing homes report, and they can't cross-reference. She said the computers don't talk to each other.
It's insane.
They don't talk to each other. How can this be? You were going data. We had billions dumped in here from the feds. We're having billions more, and I'm not hearing computers.
I'm not hearing anyone talk about how we fix this system. And let's take the money and actually put it to use in something like this. But, Charlie, I will tell you, working for the federal government, I used to call it the fuzzy Fed world. In the regular business world, especially in news, deadlines matter. You don't have time to sit around and play with this stuff. They would take forever. I was like, what would have taken me 5 minutes would have to take me like 5 hours, because I had to figure out a way to get around the fuzzy Fed world. And it's the same word. Let's stop. Let's just stop. If we ran it like a business, we wouldn't have this problem. And when you're talking
I don't
about
know about
data,
that.
well, we wouldn't have it to the extreme because a lot of people would be fired. A lot of people would be
Well,
fired. When you work for an agency
Trump was a businessman.
yeah,
Trump was a businessman, and the economy was growing only through deficit spending. And Snyder was a businessman, and you see about Flynn. All I'm asking is competency, get up, earn your check, and you don't work for the political boss. You're supposed to work for us.
well,
But every year, the cycle is who gets these jobs for their nieces.
Yep.
That's what it turns out to be.
And I will tell you too, Charlie, someone who's you see when you're on the inside, it's all politics. And when it changes leadership, it changes in the political arena and how you do your job every day. And it's also typically in government. Sadly, you don't step out and you don't talk out. And if something happens, everyone will support you behind the scenes, but no one will step up and support you because they're all worried about their own butt. So I see before sitting on the outside. The Flint water crisis, you're like, how does this happen? Once you work for a government agency, you're like, yeah, I'm surprised that hasn't happened sooner. Because no one speaks up, and when you do speak up, you are then going to be an outcast, and they will make your life miserable.
And I mean, like what's going on in Detroit, we all know it's not a secret. The federal grand juries, the demolitions, the poison dirt in the ground. Who's even talking about that? Nobody. It's an election year. Look at Greektown. That's mayhem every weekend. Shootings, fights. We starved the police. Nobody's talking about it, right? We can go on and on and on, but we have to do better for our kids. Like you said, 20 generations. Forget 20. How about the next one?
And with that, you're right when we say we could talk forever, especially about the demolitions. It's my pet peeve. I did a story like along with you, and we were talking about the dirty dirt long before. And then, the cemetery. Right now, I did that story so long ago. No one would take me seriously.
Well, now that the reports are out, the dirt is poisoned. The reports are out.
Yeah.
The Inspector General, Army Corps of Engineers. So when the shoe drops, are we taking all these Biden bucks that he sent to Detroit and paying for that? If you look at, I'll say this real quick. You look at the budget proposal by the Biden administration, and their anticipated rate of growth over the decade is 2%. That's real growth, not nominal growth. That's taking inflation out. 2%. That's what was happening in Trump and Obama. We've been staggered along at 2%. But you just injected $6 to $10 trillion into the economy, and you're going to get 2% growth. That says to me, what's inflation going to do? What is the projections for inflation? So everybody that saved money, you're middle class, you have a nest egg, does inflation start eating away at your savings? Big pieces of public policy that aren't being discussed.
It all comes down to, remember, it's not free money. If I hear another politician say it's free money, no, it's our money. It's our tax dollars. And with that, Charlie, we could have an entire show with you, but in the meantime, tell us, number one, why this matters, and number two, where can people find your work?
Why what matters?
The numbers on the nursing home.
Okay, the numbers on the nursing homes matter because numbers represent people. So, your loved one died. You have a right to know where they counted. Number two, these numbers give you a gauge of what's going on with end-of-life care in America. These numbers should qualify the direction in which we go into the future. And three, finally, these numbers give you a gauge as to the quality of leadership that we may have had or may not have had during the pandemic. You can find me. It's the computer world. You just put in Charlie LeDuff, you'll see a bunch of garbage. And you'll also find the No BS News Hour. It's about 100,000 strong now. It's basically a radio show on the internet. You can see it on Facebook. You can download it on iTunes. We also broadcast on Facebook. And we're going to 2 days a week now. We're starting to hire videographers. So we'll be back on YouTube. We're growing. It's going well.
That's great. And I know that you also still write for Deadline Detroit.
I didn't mention that. Yeah, I write for DeadlineDetroit.com.
That's okay. I got your back. I will say, Charlie, you know I've been a big supporter and always appreciated your work because when people talk about you, some people want to say things. I was screaming at Fox 2 the other night. They had someone on there. And I was like, what are you talking about? Don't even get me started. I think she might have even been like from MLive. I'm like, that's the worst publication.
That was just some Democratic hit squad. I don't care. You know, I mean, I care what my mother thinks about me and my friends and, you know, my wife and my daughter. The rest of it it's a show.
Yeah. But we will say, too, journalists don't dog other journalists. And when we're talking about, I know, hey, journalists, if you're out there, be responsible. But we do know a lot of great reporters. It's not necessarily them. They're either not given the time or the resources, but it's also the people that are higher up that are making those decisions, not allowing them to do these stories. So
yeah, no guts.
Exactly.
But yeah, I mean, there's tons of great reporters, and it's not that they're not doing good work. They are doing good work. It's people are just starting to drift away.
Yep.
You know, people are just looking for their own. They feel unfulfilled and unsatisfied. But there are, you know, there's the Christine McDonald's and the Paul Egans and the Rob Snells and the Chastity Pratts. You know, I mean, they're out there. There's a lot of them.
I always like
a lot of people.
Robert Snell. I'm like, what's your Pacer account bill every quarter? But I will say, as someone who was a PIO for federal law enforcement, they made my job easy, but it was always fascinating to see the Chicago market never gave me a pass like the Detroit market. So always interesting. But
that's
Charlie,
an issue.
It is. We appreciate your time, but more importantly, we appreciate your work. And as you said, the numbers matter too because policy changes because of these numbers, and we need the truth to make a difference. And if you want to start really addressing into care life, like they're trying to throw money at childcare right now, we need to make sure this actually gets to the people that need it and not to the fat cats that own these companies that haven't been responsible throughout the entire time anyway, that are just going to get more of our tax dollars. So we appreciate your work. Keep it up. And everyone, please follow Charlie, subscribe to him, and support his work.